We'll have to discuss about the other types of headaches. In the previous video, we have discussed about the migrainous headaches, which are very common. And the other types of headaches like vascular headaches, cluster headaches, tension headaches. So we'll just go through with today with the tension headaches and cluster headaches. So how the tension headaches will be seen and how the clinical picture will be there. Basically the tension headaches were of a milder variety, means the headache is very light, of light intensity, but slowly the intensity will be reached in a couple of hours. Okay, so it starts with a mild headache and mild tenderness of your headache. If you feel some sort of tenderness in the head, it's a dull aching sensation which is distributed all over the head, and by the day goes off, the headache intensity will be more. So it is not episodic. It is maybe can be due to a stress event, or it can be anything. Sometimes this headache will be radiated to your shoulder, to your back of your head, and also sometimes associated with a kind of sleeplessness. So it may be prolonged throughout the day. So, but it's not an episodic. It is only because of a stress event, like sometimes lesser sleep, or your food habits, or it can be due to inadequate time taking for the feed. So these are the small events. So what should be done for that actually? So adequate sleep, timely food, weight control, physical activity of around at least 30 to 60 minutes a day is always necessary to a kind of reduce the intensity of headaches, and also a milder NSAIDs can be used as if this milder headaches going to a moderate or severe variety, then you need to find out. But these are less incidence kind of because it's typically based of a stress induced. Only the triggering factor is a stress. Okay, the other types of headaches what we see was the cluster headaches. So the cluster, the word itself shows it happens in clusters. So it can be a simple cluster of almost 1 to 8 times episode can be, or a milder variety of 1 to 2 frequent episodes in a day, or sometimes in a severe variant like 6 to 8 episodes per day, and it happens in clusters throughout the day when the interval free period will hardly 1 to 2 hours, and again the cluster starts. So this can be in a day or sometimes in a month even, with a pain-free interval of 2 to 3 months, and again the cluster starts. So this is called the cluster headaches, which is most commonly seen in males. Almost incidence of 5:1 ratio. If you see male and female ratio, the preponderance level is more in males, and those especially in the age group of 30 to 60 years of age group, it is very common. And what are the etiological factors? It's mainly the smoking, which leads to a narrowing of the vessels called atherosclerosis, and also it can lead to diabetes, which leads to further vasculitis, and also can cause a cluster headaches. So how the pain will be? The pain will be distributed on the one side of the head, involving the eye and also in the nose. So how the intensity will be? It is a severe pain and a throbbing kind of headache, painful, associated with some sort of redness of the eye, and also the watery discharge from the eye, and with a blockage of your nose, sometimes with a severe episode leading to vomiting sensation also. So this may be slightly confused with a migraine, but migraine doesn't cause any cluster types of distribution, but it will be a chronic tendency with an acute relapses. But if you see the clusters, they'll have recurrent episodes in a day or sometimes in a month even, with a pain-free interval. Then again it starts with after 2 months the cluster may be causing the relapse again due to any other triggering factor. So the lifestyle management is ultimately the first factor to be corrected, and we should cut short the cycle of the event. We should mainly take some medication, or as prescribed by your physician or any neurologist. So definitely we should cut short the cycle, and the pain-free interval should be maintained well, and with an adequate sleep, and reducing the alcohol intake, and you should quit the smoking. So these are all the milder varieties. But if the severity is getting worse, and like if it happens throughout the month, then definitely you should find out the structural cause of your cluster headaches. It can be of a vascular anything like, or it can be a simple like tumor, or it can be a malignancy, it can be anything. So better always early diagnosis and treatment is the first thing to be done, because if you reduce your cluster burden, then definitely your pain-free interval will be good and improved. And always to rule out the structural pathology, like it can be a vascular event, or it can be a stroke. Like vascular event means it's like a stroke, or it can be like a brain tumor also. So don't neglect yourself, always to be make sure that early diagnosis is always good and prevention is better than cure. So I would say the same things, like always the lifestyle management and reduce your stress, like spending time with the kids and also with the family members also can lead to definitely the diversion kind of, and also the cluster can be reduced. So these are all the things. And coming to the medication, don't use your self medication or don't use any sort of drugs to reduce your headache. And because many times it is like the habituation of drugs, which also causes the rebound kind of headaches, which we'll discuss later. Thank you very much.